Hi everyone, my name is Lorna Samuel. This is my week 7 presentation for DNPU 705 Health Communication. Topic is Proactive Health Communication Campaigns. So today we are talking about opioid use disorder. Over 16 million people worldwide are opioid dependent and would meet the criteria for opioid use disorder. 3 million of them are in the United States. Opioid use disorder results in over 12,047,000 deaths per year worldwide and in the United States. 120,000 worldwide and 47,000 deaths per year in the United States. The Medication-Assisted Treatment, MAT, program for opioid use disorder is a program that consists of using medications and psychotherapy to treat opioid use disorder. Treatment is mainly the use of Suboxone, which is a sublingual medication. We have a problem with medication non-compliance because patients are not adherent to their medications. They don't take their medications, which is a big problem. I will be talking about identifying the at-risk population for opioid use disorder. I will be describing the health risks. I will be talking about health promotion, importance of medication adherence, theoretical framework, multimedia approaches, and I will be talking about my resources. So opioid use disorder, the health risks of opioid use disorder are that they affect the quality of life of patients, they affect the economy, cost of treatment is very high, they affect rural prosperity mainly because high rates of overdose are recorded more in our rural communities, and then it's devastating to victims and other families. So basically, living in a rural community is one of the greatest risk factors for opioid use disorder. In 2021, drug overdose deaths in California were higher in the rural areas than the urban areas. So the rural areas of California had the highest rates of drug overdose from opioid use. San Francisco County in California had the highest opioid-related mortality rates in the year 2021, and the subpopulation that has the highest mortality rates from opioid use disorder in California is the Latinos. Opioid-related ER visits among Latinos were higher than in other subpopulation. So it's talking about health promotion. I'm going to talk about prevention strategies. How do we prevent opioid use disorder? So there is a hotline that people can call to get help, and it is 1-800-663-HELP. We have the International Overdose Awareness Day, which is August 31st of every year. And on days like this, there's a lot of sensitization going on. You see media programs, flyers, brochures about opioid use disorder to raise awareness. Another thing that we can do is improving opioid prescribing. So I put the link there that can help to promote and support the use of clinical practice guidelines for prescribing opioids for pain. So it's a CDC It's a CDC link that just has practice guidelines for prescribing opioids, and this is for uh, prescribers, for practitioners. And then if we also should increase maximum use of prescribing drug monitoring programs, which are state-run databases that track prescription for controlled substances, and they can help improve opioid prescribing and inform clinical practice and protect those at risk. So it's a database that tells you pretty much how much each patient, which narcotics patients are getting, to prevent polypharmacy or to prevent patients from getting the same medications from different providers. And then it's learning about the risk of prescribing opioids. This is the link to CDC's RX awareness. Um, so it talks about the risk of prescribing opioids and about the help and resources that are available for people who might be struggling with opioid use disorder. And then the other next thing is to learn about reversing overdose by expanding access to Narcan. So if patients have Narcan, they can use it whenever they feel like they've overdosed. Or it can also be made available to family members and friends. Importance of medication adherence for opioid use. It decreases the risk of future health events like overdose and deaths. It decreases healthcare costs, better treatment outcomes if patients adhere to their medications. It also reestablishes normal brain function, reduces cravings, and prevents relapse. So, theoretical framework. Uh, Peplow's theory of interpersonal relations is the theory that I used, and it focuses on nurse-patient relationships. It has four phases of the nurse-patient relationship that are utilized to attain a shared goal. The phases are the orientation phase, the identification phase, the exploitation phase, and the resolution phase. So, what's the relationship between Peplow's theory and opioid use disorder? The theory of interpersonal relations is a middle range nursing theory developed by Peplow. Uh, Peplow saw the need for the nurse and the patient to form a partnership rather than for the patient to receive treatment passively from a nurse who is passively probably following doctor's orders. So, according to Peplow, the nurse must interact with the client as a human being with respect, empathy, and acquaintance. And when this happens, um, we when we interact respectfully and empathetically and accept the patients as they are, we can control addiction bias in patient care. And addiction bias is one of the things that causes patients to not adhere to their medications because of the stigma that is involved with opioid um, use disorder. It's pretty much the same slide here. Still talking about improved patient outcomes, the nurse-patient relationship, treating patients with respect and dignity to prevent bias. So multimedia approaches, we can use mobile apps to help improve medication adherence for patients with opioid use disorder. We can use most of the apps have options for medication reminders. They have a supportive community where they can meet other people with the same issues. Daily pill setups, like the picture you see above, brochures. This is an example of a mobile app. It just it helps with reminders for when to take your medications. You pretty much put all your medications record all your medications, and when it's time for you to take your medications, you get a reminder. Uh, Resources, like I said, there's a hotline. We have mental health services. We have medical care. We have recovery support services, counseling services, and then we have the medication treatment program, the MAT that I told you about. We also have equipment for resources. We have equipment, we have facilities and support uh, equipment like medical equipment, safety equipment, ambulances, fire trucks, medical support, hospitals, mobile treatment clinics, outpatient clinics. They will also have workforce development, strategic planning, and community planning. And here are my references. Thank you so much for watching.